everyone. I welcome you all to ESC Dialogue Episode 5, Vaccine Diplomacy, Prospects and Challenges for Bangladesh. ESC Dialogue is the signature panel discussion event of our organization, which facilitates discourse on pressing socioeconomic issues related to Bangladesh. Today's episode will focus on how the race to a COVID-19 vaccine will influence the global economic landscape, its implications in Bangladesh, and how we can ensure equitable access. As the chair for today's session, we're honored to have Dr. Rumana Huque, Professor, Department of Economics, University of Dhaka, and Executive Director of ARC Foundation, a research NGO. She's also working as the Project Director of the Communicable Disease Health Service Delivery Research Program Consortium. She specializes in health system and health economics with special focus on healthcare financing, resource allocation and budgeting, and economic evaluation. Amongst our esteemed panelists, we're pleased to have Dr. Delwar Hossain, Professor, International Relations, University of Dhaka, and Director, East Asia Center, University of Dhaka. He was also chairperson of the IR department from 2009 to 2012. Dr. Delwar specializes in international relations theories, globalization and international cooperation studies, foreign policy analysis, and area studies with special focus on South, Southeast, and East Asia. Next, we have Dr. Ashikur Rahman, senior economist, Policy Research Institute, and member of IID Policy Breakfast Advisory Board. He has worked as a consultant for a number of government bodies and other prestigious national and international organizations, including the Planning Commission of Bangladesh, World Bank, UNDP, DFID, and Japanese International Cooperation Agency. Dr. Rahman's field of research interest is political economy, and he's contributing extensively in areas like development and governance, with a key focus on implications of institutions on economic performance. Our final panelist of today is Dr. Shejiti Saha, scientist, Child Health Research Foundation, Bangladesh. Dr. Shejiti Saha was the lead of the team who decoded the genome sequence of SARS-CoV-2 in Bangladesh. Currently, she's appointed by World Health Organization as board member of Polio Transition Independent Monitoring Board, the first ever Bangladeshi to hold this position. Dr. Saha is an activist who believes in health and research equity. Her work focuses on preventable infectious diseases and analyzes the indirect impacts of interventions like vaccines. We're thrilled to have you all with us today. I would now like to give the floor to our chair, Dr. Rumana Huque, to conduct the remainder of the session. Thank you.
Thank you, Namira Shamim. Am I audible?
Yes, ma'am.
Thank you, Economic Studies Center, for arranging this dialogue, very timely and very important. Thank you for giving me the opportunity to chair this very important session. So we all know that the pandemic, when it started in December 2019 in Wuhan, first we struggled with identifying the patients and how to combat the disease and what is the nature. And we all know that we really struggled, and even World Health Organization, they were giving different perspectives, different informations. We got confused. And when the first case was identified in Bangladesh in March 8, then we really focused on contact tracing, identifying the patients, and then later we discuss about the health system preparedness, budget allocation, how we are combating the disease. But now, or maybe for last couple of months, the discussion mainly focused on vaccination, because we realized that to combat these these communicable disease, we really need vaccination, and this creates a challenge for a developing country like Bangladesh, that how we can cover the 160 million population in these, for the vaccination. So coverage remains a challenge, and the huge budget. So how we will get the budget? Will this be free, or do we need to pay for this vaccination? And even if we get the vaccination, will we get the amount to cover the entire population, or do we need to prioritize some people? So all these issues came up during our discussion for last couple of months. And recently we know that from the Ministry of Health, they just announced, I think 2 days back, that Bangladesh has signed contract with 2 organizations. One is with India, who will provide us around 3 crore vaccination, and another is with Gavi, Global Alliance for Vaccination and Immunization. They will provide us around 6 crore, more than 6 crore vaccinations. So altogether, we are expecting around 10 crore vaccination in Bangladesh. But still, it is not enough. And the price of this vaccine will also vary from $2 to $6. And then also it has been said again by the health ministry that there will be prioritizations of all frontline health workers might get it first, elderly people will get it first, and then they will try to cover the rest of the population, and it will take some time. So from that perspective, I will not discuss more, but I would like to hear from our distinguished panelists today, that what is their reflection, how they feel that how Bangladesh is coordinating with uh, international organization, different countries who are producing or distributing vaccines, and whether we are doing a good enough to secure the vaccines and cover the entire population of the country. So I will start with Dr. Delwar Hossain, Professor, Department of International Relations, University of Dhaka, to get your view that in this perspective from the diplomacy, the challenge that we are facing. So, what is your reflection? So, over to you, Dr. Delwar Hussain.
Thank you, Professor Rumana, and I also thank Namira and particularly Economics Study Circle for organizing this dialogue on a very important, very relevant issue, not only for Bangladesh, for the entire humanity. Uh, and of course, this is a very broad issue in the sense that we are talking about vaccine diplomacy, which covers almost every part of the world, and then we are focusing very specifically on Bangladesh. And then yes, Bangladesh has also different types of challenges and also opportunities to face this very different time that we all are actually facing. So as you have rightly pointed out, I mean, in your introduction, that this is an issue which is very global in nature, and it has devastating impact on humanity in every part of the world. And we know some countries are suffering very high, including a very rich country, or the most developed country, the United States. Uh, well, the title of this dialogue is quite interesting to me. As a student of international relations, I get perplexed or sort of I mean puzzled. I mean, when we find that over the last 9 months, the issue of COVID-19 global pandemic, and now it has reduced to the idea of vaccine. I mean, to have an exit plan from this disastrous situation. So perplexed in the sense that, hello, is it okay? Am I audible?
Yes, yes,
Okay.
you are audible.
So it's very perplexing in the sense that so far we have not seen much global cooperation or global governance in such an issue as a health issue, public health issue, and also to me it's a humanitarian issue. So far what we generally see that there has been a number of political and diplomatic implications of this particular pandemic, and also the very specific issue of vaccine development or vaccination process. So generally what we see, there has been a growing dissatisfaction with multilateral governance that we can explain, but we know we have very limited time. So we know that so far the world community remains extremely non-committal to a kind of substantive level of cooperation. We know the role of the international organizations, regional organizations, and also the big powers who have actually shown much more nationalistic kind of tendencies to deal with this crisis. So we have seen that geopolitical rivalry and technological competition has become a reality, and then we have also heard about the debate, the politics versus science, or the idea of politicization, stigmatization. So we rather see a sort of crisis of international cooperation centering on this issue of vaccine and also overall the issue of COVID-19 pandemic. And since we are focusing on Bangladesh, of course, for Bangladesh, the problem is not very different. But if we consider the vaccine diplomacy, so we need to understand what kind of diplomacy it is. We are familiar with different types of diplomacy, climate diplomacy, environmental diplomacy, economic diplomacy. And here now we are talking about vaccine diplomacy, which reflects a new reference point in understanding dealing with a problem which is very different nature. I mean, in defining the issue, I mean, people are talking about the problem of high politics and low politics. Apparently, vaccine to COVID-19 is basically it's a low politics issue. But now we can see, because of the so-called nationalism, the so-called geopolitical rivalry on this issue, I mean, it has become an issue of high politics. And also there is a debate between public good and private good, how we can address this issue. So the very issue of vaccine and diplomacy focusing on this very particular reference point, I mean, it is quite interesting and new development. And I think other panel members will talk about different issues. So I'm not dealing with these. I mean, all aspects. I mean, just we know so far we have reached to some extent. I mean, very encouraging stage as such. I mean, in terms of vaccine development. But if we come to Bangladesh, what we see, we have bilateral aspect of diplomacy and also multilateral aspect of diplomacy. When we talk about bilateral aspect, we basically focus on our relations with China and India. And if I start with India, so far what we have developed bilaterally as such, I mean, if we focus on Indian policy, so we have heard from Indian political leaders that India is giving priority to Bangladesh for supporting in providing vaccine, and we all know, I mean, Bangladesh has cooperation with Serum Institute, and Bangladesh and India have already signed a deal, and Bangladesh has allowed India to have phase 3 vaccine trials. And so both the countries are talking about delivery, distribution, and co-production of vaccines. So there has been quite encouraging sort of cooperation between Bangladesh and India on this issue. Then bilaterally also, China is very important to Bangladesh, and we know that initially Bangladesh Prime Minister and Chinese President, they talked with each other about cooperating and on this issue, and eventually we know that Chinese government has also offered support to Bangladesh in terms of providing vaccine, and Bangladesh has also agreed to allow phase 3 trials of Chinese vaccine. But we also know about the dispute of cost sharing between China and Bangladesh about the trials. But so far, very recently, what we have seen that China is actually focusing not only just on bilateral basis. China is focusing on 4 countries in South Asia: Sri Lanka, Bangladesh, Nepal, and Pakistan. So China is creating sort of 5-country cooperation platform on the issue of vaccine distribution or vaccine supply. But what we see that there is also a rivalry between China and India, and we can easily understand over the last 2-3 months then how actually India and China are actually, they have their own issues of problems, we know, but we also understand that the vaccine or this pandemic has also become an issue of kind of competition and rivalry between the 2 countries, and South Asian countries definitely are also part of this rivalry. And coming to the global context, our Prime Minister's speech in the UN's General Assembly is very, very important. she has forcefully declared or pronounced in her speech that this vaccine should be a collective good or a public good. And what we see in reality in this world, that the vaccine has been developed mostly by the private sector. And as I know, more than 78% of the sector who are involved in vaccine development, they are in private sector. So we can see that there is a tendency of seeing it as a private good, or at least a good or a product which is very, very national or a country specific. So here actually Bangladesh has made it very clear that multilateral diplomacy, global initiative is very important. And then Bangladesh is also part of COVAX, as our moderator mentioned, that Gavi, Bangladesh is also part of that. And Bangladesh is also cooperating with WHO and other international organizations, and also Russia. So we have a global kind of cooperation and also bilateral cooperation. But what I find very critical for Bangladesh, or for that matter for many countries, that we need a fund for this, and we have already focused on aid. So we could see some sort of aid diplomacy involving vaccine, because access to vaccine, it depends on also the price or the fund. So Bangladesh has already approached World Bank, Asian Development Bank, JICA, and AIIB for support. And also Bangladesh has also, I believe, its own resources to get vaccine. And so aid diplomacy is also part. And then availability, well, we know Bangladesh has already declared a kind of roadmap, and Bangladesh is trying to develop a national plan for it. Uh, and of course, I mean, about 80% of people are to be covered in 3 phases that we know that will actually start in next year. But the problem of Bangladesh in terms of diplomacy, we see is a dilemma, how much we can depend on bilateral cooperation, particularly between Bangladesh, India, or Bangladesh, China, or Bangladesh, Russia. And then how much we can depend on public sector, or how much we can depend on private sector. And then there is an issue of IPR, intellectual property right, and this idea of patent, which is very, very important. And Bangladesh is supposed to also highlight this issue. And we know, I mean, India and South Africa have already highlighted it. So we have the issue of IPR, because if we could develop through technology transfer, then Bangladesh has very strong pharmaceutical sector. So we can address it in much more convenient way. And then another problem, which is also critical, but the black market is becoming also a phenomenon in this vaccine kind of or vaccination process. Because I have read a story in Japan Times where actually it has been mentioned that some are actually trying to have or acquire vaccine which is not fully approved by different countries, but in its limited approval, we could see that vaccines are being acquired in a black market by high price. I have read as some are buying it by $100 or $90 like this. So black market is also becoming concerned. So finally, what I think for Bangladesh, well, we can depend on bilateral cooperation, and also for us, the issue of fund is very important, and then technology transfer could be an important area for Bangladesh, and then well, locally we have to consider all the distributive channels and who will get first, and then and Bangladesh has already decided, and I think most of the countries in the world, I mean, they have prioritized, I mean, who will get first, frontline workers, and then other segments of people. But what is important then I become really I mean, just I would like to just conclude that I mean, in terms of diplomacy, I mean, well, there can be many issues to be involved articulating diplomacy or in articulating a sort of national interest. But when we see that this pandemic has become an issue of nationalism, has become an issue of national interest, that is really I mean disappointing for the world, and this is also an important front that we need to also fight as a developing country or as a least developed country, whatever we have our own group. So Bangladesh also needs to focus this issue not only for its own interest, that is to support its population. Also, we have regional and global concerns that is also very, very important. But well, I mean, this issue of vaccine diplomacy is really important, and we need to actually address it in a right perspective, and how much we can depend on bilateral cooperation, how much we can depend on global cooperation. And then of course global market is an important issue. At the end of the day, we live in a very capitalist world. So these are all issues that we have to consider. And I think I mean, this is a challenge that actually we have to face together. Whether we face it within a state level, then the people or different groups, we have to be together, and we have to be together regionally, and we have to together globally. That's all for now, and I think we can discuss more later on. Thank you.
Thank you, Dr. Delwar Hossain, for very insightful discussion. Namira, would you like to have
Yes.
the floor?
We would like to acknowledge Dr. Otanu Rabani, our co-moderator, and as well as Professor, Department of Economics, University of Dhaka. Thank you so much for joining us, sir.
Glad to be here. Thank you.
Thank you, Dr. Otanu, for joining and for your support in arranging these dialogue from the back. But we really appreciate your support to the team. So I will now go to Dr. Ashikur Rahman, Senior Economist, Policy Research Institute. So we have heard from our previous speaker about vaccine diplomacy, different dynamics, the geopolitical rivalry, and also the nationalism versus global scenario. Solidarity may be there, aid diplomacy, and also the Bangladesh has prepared a roadmap. So what is your reflection of in addition to, or if you want to supplement what Dr. Delwar has said, your reflection on the overall diplomacy and also the challenges. So over to you, Dr. Ashik.
Thank you, Dr. Rumana, and thank you to Economic Study Group at the University of Dhaka for inviting me over. I think Bangladesh has made its position very clear at the international stage that we view this vaccine as a global public good. I think there's no ambiguity about there. Honorable Prime Minister has made it very clear that from the perspective of Bangladesh, it is a global public good. And that is a sentiment that has been widely shared by public intellectuals and public thinkers and commentators, across the spectrum, left and right. That is nobody has so far, I've seen, gone far to the extent to make it look like that there will be a privileged section of the society who will only get it on market mechanism. The term vaccine diplomacy is interesting because for me, it is a term that does not accurately capture the narrative of Bangladesh perspective, but it is a term that came out in the discourse because what China and India was doing with this vaccine. As we saw that, if we go back to 1971, we had the ping pong diplomacy that was pursued by the US, which is a table tennis competition to open up to China, right? So when you phrase it like vaccine diplomacy, there is an inherent, the construct might make it sound like that diplomacy is of first order importance and vaccine is of either second order importance or equal importance. But from the perspective of Bangladesh, I think we have made it very clear from I think the government has at least made it very clear that we have kept our doors open both bilaterally and multilaterally. We have got into discussion with China. We have got into discussion with Russia. We have got into an agreement with India, and we have kind of explored almost all the options that are out there on the global table. So we are, from Bangladeshi perspective, yes, we are navigating the geopolitical competition between India and China. So, but so far we have, given equal hand to everybody, and from the way we have structured the engagement, it shows that what matters to us is having access to an effective vaccination as fast as possible at as reasonably priced as possible. I think if you look at the overall discourse, that has been our priority. Now, this is a very tricky area, because this vaccination, the term has been produced at such a warp speed, right? Now, I'm not a public health specialist, but when I follow these discussions at the international stage, the real delicate dance that every country needs to do is they all need to get onto the vaccination ladder as soon as possible, but they need to climb this ladder as cautiously as possible, because the product itself has not been tested and tried. It has gone through, some of these vaccinations have passed phase 3 with different levels of efficacy. The one that Bangladesh is eyeing, the Indian serum one, and the COVAX, whichever COVAX one Bangladesh gets, has a 70 plus efficacy. But then, these vaccines are just being tried, right? So we just don't know how long the immunity will last, and there are many unanswered questions. So there is a very cautious, delicate walk that we need. And I appreciate the fact that we have developed 3 phases to introduce this vaccine into the population, because I think that is a cautious way forward. I mean, me and you, we all don't know what is the population threshold that has already been infected, right? I was reading a global study. It was showing that, the immunity of COVID can last up to 6 months. I mean, if that study, we are getting new studies and new insights every 2 months, but that's the last study that I was watching, and apparently the immunity lasts 6 months. If that is so, and I feel that both India, Bangladesh, I mean, I think we have somehow dodged a bullet, in the sense that maybe science will reflect this later, in time, why the mortality rate has been so low, why the hospitalization rate has been so low. There must have been some explanation, young demography, some kind of BCG immunity that we might have. These are all hypotheses that we are working with. However, I think Bangladesh is, in terms of vaccine, I think we have approached it very cautiously, and I have to appreciate what has happened. I think we have approached the issue very cautiously, and we have opened doors that needs opening. Now the question is, for example, one thing came by, the Pfizer vaccination, which is and the Moderna vaccination that was produced by the US. Now, these things are bound to happen. For example, the Pfizer vaccination needs a cold chain management, which has a minus 70 degree management issue. Bangladesh does not have it. So Bangladesh is not going for the Pfizer/Moderna vaccine option. But the Sputnik option, the Serum Institute option, the Gavi option, I think these are promising options for the time being. And I think at this point, while the rich countries are stocking it up, I think countries like Bangladesh, India, China, there is a common platform here to make that heard that this is a global public good. We saw in recent news that 4 countries have already booked, US, UK, sorry, not 4 countries, but 4 blocks. US, UK, Japan, and EU have already booked 4 billion doses for their population. And that's understandable. I know some people are calling it vaccine nationalism, but look, let's face it, they are also facing the huge kind of wave that Bangladesh and in many other countries have not faced. What is happening in America, what is happening in Europe now is still not happening in any part where we are living. The kind of trauma and the kind of the devastation that this virus has brought. So it's understandable that they are taking more caution for their citizens. I mean, if you want to call it vaccine nationalism, fine, but I think I don't see anything vaccine nationalism about that. But I think we have to do our bit and make that story get more traction, that this is a global public good. And if it is a global public good, the point that Dr. Delwar was touching, I think we have an intellectual property right. So at some point in time, Bangladesh should get the right to produce it, right? So that debate needs to be sorted at the international level. But that is again a complicated, debate, and we don't have too much leverage at the global stage, even India, to sort out that debate with the global pharmaceutical companies. But at this stage, we must try to get the vaccines that are happening in India and China and Russia as soon as we can, but then also cautiously mainstream it to see to be cautious about its side effects and everything. So I think I will stop there, and if you have any questions, I can answer on anything that I did not address.
Thank you, Dr. Ashikur Rahman. You have given us some insights, and these are all very useful. And I think we'll come back to you with some more interesting questions. So I will now go to Dr. Shejuti Shaha, scientist and activist, Child Health Research Foundation, Bangladesh. So Dr. Ashikur also rightly mentioned a few issues that we are still not sure about, the efficacy of the vaccines that we are considering now, and also the dosage and how long it will sustain, or it will be like immunity of the population. So these are the issues that we really want to know from you. And also if you can give some idea about the management issue that Dr. Ashik mentioned about the cold chain management, and what is other requirements that we have to have in place before we start importing those and try to cover the population. So over to you, Dr. Shejuti. Would like to hear from you.
Absolutely. Thank you. Thank you so much for inviting me in this panel. It's quite different than the panels that I usually go to. I'm usually talking to a lot of microbiologists and biologists. So it is actually quite a new experience for me. And I'm very excited to be here and learn and share perhaps some of my experiences. So, we've been talking over here about COVID, SARS-CoV-2. We're talking about the vaccines that are coming up. These are all new, new disease, new vaccines. The issues that we're discussing are not new. These are age-old issues, right? Access, equitable access to vaccines have been an issue for Bangladesh or, LMICs and disease for years and years. So I think it's really important that we are having this discussion. We're leveraging COVID to have this discussion, but today, tomorrow, next year, COVID is going to go away. I really hope we continue this discussion, these learnings from here, and apply those to other diseases and vaccines also. So let me start broad, because I started with this idea of it's not a COVID specific issue. What are the main challenges that we face in this field of vaccines? The main challenge that we have in health sector when we are trying to get vaccines is data. We don't have very good health surveillance in place in countries like ours. We often do not understand the real burden of disease, or what are the pathogens, what are the bacteria, what are the viruses that are circulating in Bangladesh at the moment. When we don't know that, we cannot figure out which vaccines to bring. We can industries are not interested in, let's say, investing on vaccines or other preventative measures, because they have no idea what the market in countries like ours look like. And, it's a problem we have in the entire subcontinent, which is a huge proportion of the population. So really, if there is data available, I think we will also see a lot of other pharmaceutical companies coming up to make vaccines specifically for us. When we don't have data, not only burden data, we have been talking a lot about with SARS-CoV-2, but genomic sequencing. Why are data like genomic sequences important? It's important because often, unlike in the case of SARS-CoV-2, even if it's the same bacteria, the genetic material of that bacteria vary according to countries, vary geographically. A vaccine made for the same bacteria might work very well in America or Northern Europe, but might not work at all in countries like ours. And we have seen that with previous vaccines, like one of the vaccines now that Bangladeshi children get is the pneumococcal vaccine for meningitis and pneumonia. When the first product of pneumococcal vaccine came out, we actually saw that it wouldn't work for Bangladesh at all because the vaccine was completely designed based on North American data. But later, new vaccines were designed taking our data into consideration. And then, of course, there is access, right? So all Bangladeshi children get this other vaccine called the Hib vaccine. It is also for meningitis and pneumonia, and it was introduced in Bangladesh in 2009. But that was 21 years after it was introduced in US. That's a huge time gap. And that's because, people didn't believe this disease existed in Bangladesh. We needed to generate that data, show the economic burden, the social burden of that disease in order to get that vaccine 21 years after it was first introduced. So I think these are all the issues that we have been facing constantly. And of course, it is being mirrored and magnified by the COVID-19 situation. So coming to the logistics and management issue, our EPI program is very, very good, right? We knew that Bangladesh has one of the highest vaccine coverage in the world. It's actually in many, many meetings, even in WHO. We talk about how Bangladesh is an example of how pro-vaccine our culture, our society is, and what a high coverage of vaccines. We have our EPI program is really good. However, normal EPI program, when we are only delivering childhood vaccines, is quite different, right? Than when we want to vaccinate the entire country. Of course, there are many, many logistical challenges of cold chain. How do we keep everything cold at between 2 to 4 degrees when also our temperature is so high? I think this is something that we have to figure out, and not only us, globally, people are trying to figure out how to maintain cold chain. And this is something where we really need multidisciplinary approach. Only the EPI or only a certain ministry of the government will not be able to figure it out. We need to talk to engineers. We need to bring in the transportation ministry with us. US, UK, they're already bringing in logisticians from the military. We need to talk to them and see if we can get ideas from the logisticians of the military when we have a lot of experience, right? Bangladesh is also known for flood management. We get our forces out, we manage flood very quickly in large scale. How are we doing that? Can we bring up all of those lessons, bring together all of those lessons for also vaccine delivery? There are these dots that can be connected. And I think it's really, really important that we're having these discussions and we really make this into a multidisciplinary approach. Another question that you had also asked is about safety. Safety is, of course, a concern, right? Safety is a concern with any new vaccine, any new drug. And this has become a specific concern at the moment is because at the speed at which vaccines are being made. And that worries me a lot because if the concern is too much, something else that we're not talking about a lot is vaccine hesitancy. We are seeing in many countries, specifically developed countries, where actually a large proportion of the population do not want to take the vaccine. They are hesitant. And that's a problem because at least for COVID-19, it's a disease that affects everybody. And if we cannot protect everybody, if not everyone is vaccinated, we cannot save the entire population. So it's really, really important that we vaccinate everybody and people are willing to be vaccinated. That's why we also need to constantly be transparent and communicate all the safety issues or concerns that we have. So why are we seeing such good data so quickly for COVID-19? Let's think about it. Why is there such a huge time difference? Never in the world have so many scientists worked together. In my field, I don't know any colleague, any scientist at the moment who is not working on COVID. That has never happened. the amount of data that we are generating on the disease, which are required to make vaccine, to take vaccine to clinical trial, it's crazy. It's more than more than what we have ever seen. Funding. We have never seen so much funding. So many governments get together and give funding to pharmaceutical companies for vaccine design and development. So I think these companies also have a lot of incentive. They see a market, right? A market of 7 billion people. That's why companies are also working much harder than they ever would, and they are investing all their resources. So obviously we have kind of shortened that lag phase when we are trying to design, we're like trying to get scientists interested. A large amount of time is during vaccine development is taken up by clinical trial. That takes years and years to actually get good clinical trial data. But normally what happens, right? A company will go to a country and will target a population, will vaccinate a few people and wait for the diseases to occur. Let's say the cholera vaccine. The cholera vaccine trial actually happened in Bangladesh. When you do a cholera vaccine trial, you have to vaccinate a large amount of people, wait for the rainy season. After that, you will see cholera cases. And in that season, you will look for cases who got cholera and who didn't. If you look at meningitis vaccine trials in Africa, you have to wait for the dry season when you will see cases, and you only do it in a small number of countries. What COVID has given us the opportunity to do is vaccinate hundreds of thousands of people at the same time when the rate of disease is really high, so high that we see enough number of cases in the placebo group and non-placebo group to make some statistically significant inferences, right? That we normally don't see with other vaccines. So that also shortens the time significantly. Despite that, as we were hearing from Dr. Ashikur, that it's really important that we are cautious. And it's important because, even if it is a 1 in 1,000 case where there's a side effect, when you vaccinate 7 billion people, that's a lot of people who will have that side effect. So we have to be extremely, extremely careful. The vaccines that we are using, specifically, what we are most interested in, Dr. Ashikur was also mentioning, is the AstraZeneca Oxford vaccine, also being made by Serum Institute. That is actually a vector-based vaccine. This vector has been used to make other vaccines before, like the Ebola vaccine, and it's considered safe. So I think that is also good news for us. Thousands of people have already been vaccinated. Now, whatever the efficacy of the vaccine is, at least for now, it looks like there isn't any immediate serious side effect, which is, I think, also a very important point to keep in mind. Now, I'm almost done. I just want to finish up by touching on equitable access. Is equitable access, equity in vaccine, a reality? It never was a reality. Let's be honest, it never was a reality. Will this be a reality in the near future? I don't know, but I think it's really, really difficult. In order for us to actually ensure that we are able to protect our population or our subcontinent and have good access, as Prime Minister said, that COVID-19 vaccine is public good, and I think every vaccine is public good. And in order to ensure that equitable access in the near future, I think it's really important that we are self-sufficient. Bangladesh used to produce massive amounts of vaccines. We did produce smallpox vaccines at some point. We used to make the tetanus toxoid vaccine, but we're kind of losing that with time. I think if any lesson that we should take away from the COVID times and all these discussions we are having is that we need to build our own infrastructure. We need to start. We're seeing some initiatives in the country already, but it's really, really important that we incentivize our in-country industries to develop vaccines. We have good programs and regulations in place within the country to run rigorous clinical trials, and that our people have access to our own vaccine. We have a lot of pharmaceutical industries in the country, and I think if we really want, we can also use those pharmaceutical companies to make vaccines. I think I'm going to end there.
Thank you so much, Dr. Shejuti. These are all, again, very useful discussion and very interesting, insightful. So I will now go to Dr. Delwar Hossain. We have received a number of questions from those who are following us on Facebook. So, Dr. Delwar, we have two questions to you. One is from Tanzim ul Islam. He was saying that uh, any country like India or other, do they have the capacity to provide vaccine to Bangladesh after serving their own population, huge population basically? And another question for you is also from Sadiq Mahmoud. He was saying that if we consider of procuring vaccine from one country, will that create some sort of tension for with other country, and whether our relationship with some country will be hampered or will have any influence of these due to this vaccine diplomacy. So over to you, Dr. Delwar. Two questions.
Okay, thank you very much again. Yeah, I understand. I mean, if I just talk about the first question, well, I mean, country like India or China, they have their own huge demand. I mean, the population of 1.3 billion or 1.4 billion people. But I mean, no country can actually vaccinate their population just in one go. I mean, they will go phase by phase. So to provide like Bangladesh a sort of I mean, part of it, I mean, it's not very difficult. I mean, India, it depends. Actually, India is not the independent kind of developer of these vaccines. So India is also developing in collaboration with Oxford and other countries. And also there is also a sort of when we talk about COVAX, I mean, it is also a multilateral forum or platform. So actually, it is not when India says India, it's not just India. So it is actually a collective initiative. So I don't think it would be a very problematic for India if India really wants to support not only Bangladesh, even some other countries also. I mean, from the collaboration that India has developed with other countries or with other institutes. So here, I mean, of course, India has its own compulsion. I mean, because of its high population, definitely India has this in her mind. But then covering some other countries, and not actually, India is not going to actually meet the entire demand of Bangladesh. It is part of demand that Bangladesh has that India might support. But of course, Bangladesh will not depend singularly on India, or for that matter on any country. So from that point of view, I don't think it's a problem. But this concern is there. I understand. I mean, but then since it is a collective initiative, and also it is a policy where actually India would not follow in the sense that sacrificing its own national interest or its own population, because like Bangladesh or like any country, I mean, it is really difficult to just give vaccines to all people at a time. So it's a long-term process, and so I think it is possible for India to support Bangladesh if it really wants. And then well, vaccine is, this is a kind of by nature a public good, and it is also related to public health issue, and as it is related to humanity. So I don't think, I mean, typical diplomacy that we see that if there is cooperation on one issue with one country, then other country gets sort of I would say, I mean, in an unfavorable manner. No, I don't think. I mean, China would think the way that well, if Bangladesh has cooperation with India, and China would not come up with cooperation with Bangladesh. I think this can go simultaneously. So it is not only just Bangladesh, India, or Bangladesh, China. I mean, Bangladesh is actually focusing on bilateral linkages. I mean, it is all about linkages. I mean, it is not that it is the panacea. I mean, we'll get everything bilaterally. I mean, with India or with China. I mean, so China definitely understands it. So I don't think, I mean, cooperation with China or Russia or with India would actually constrain our cooperation with other countries bilaterally, or even the multilateral platform that we have, and that actually we think should be a very strong kind of way to ensure at least a relative level of equity. I mean, we may not get absolute equity or very high access, but we need a minimum level of equity globally. So we don't want to think that I mean, Western countries or rich countries, they are dumping things. I mean, like what we have seen. I mean, in the history, they have done it. So they should not be overly or very narrowly or parochially concerned about their own citizens. Of course, they should be concerned, but overly concerned, and but they can also, simultaneously consider other countries. So the global initiative is also very important. So I don't think this will have adverse impact on Bangladesh-China relations if we have cooperation with India or any other country for that matter, or even because all options are open for Bangladesh or for any country. Thank you.
Thank you, Dr. Delwar. So we have a number of questions to Dr. Ashik, and I will just ask two questions, two related questions maybe to you. One is from Sharika Shabha, and her question is that our finance ministry has already received or sought like $2 billion US financial assistance from 4 development partners to purchase, store, and transport, administer the vaccines. So the in the current economic context of the country, what is your reflection on these? Do you think that we are really in a position to get these loans and repay the loans and provide this such large scale social security? And I would like to ask a related question to that from Abraz Basha, who also raised the question of corruption in using the money that we also know when we started procuring different products for vaccine management at the initial stage. So what is your reflection on getting these social safety nets and also managing the corruption in Bangladesh context? So over to you, Dr. Ashik.
Thank you. Now, in terms of, see, every developing country, this is a global crisis, and Bangladesh has been, has taken a hit like almost all other countries. So we have a legitimate right to seek global assistance for funding this arrangement. But so $2 billion is what government has asked. I haven't spoken to development partners. I don't know exactly how much of it will be honored, but I'm quite sure a part of it will be honored. Like every other thing we have asked for, we have a very good debt history in terms of handling debt, in terms of handling loans. So that should not be a problem. But even in case that say they only give us $250 million, just say a hypothetical scenario where like only 25% of what we have asked for is met, I don't think it's a problem for Bangladesh at this stage. We have very good reserves, and somehow, and due to a fall in import, and yet a kind of a steady scene at the export and remittance level, we have a balance of payment situation that does not really mean that we will have a big dent at our reserves for getting these vaccinations, as I can see it. And the vaccinations are not also very expensive. If you see the Gavi initiative, it's only $2 for per dose, and the Serum and Institute is $5. The Chinese option is $10 to $11, as I have seen. But again, we are unlikely to get all of them at the same time. We are not going to inject all of our population at the same time. It's going to happen over phases. So whatever resources are required won't be required within like a matter of 1 month. It will be required over a period of 6 to 12 months. And so the pressure on balance of payment or Ministry of Finance is likely to be very low. In terms of governance, I think it's fair to say that after the pandemic started, a lot of issues of concerning poor governance came up. But it is also true, as you know, that the government did respond to a lot of these governance problems that have came up, right? So they changed the secretary, they changed additional secretaries, they arrested many people who were involved in this sector. So developing countries will always have governance issues that comes up. But the question is, once they come up, are you seeing an acceptable degree of action? And I think after the pandemic has emerged, almost like all other countries, we were caught off guard, like almost all countries, and a lot of issues came up. But I think the good news is, and the kind of the light at the end of the tunnel is, that once these issues came up, I think they were robustly, more or less addressed. And I think, touch wood, Bangladesh has, not seen scenes like what was seen in Brazil or what was seen in Europe or what was seen in US. We had a tough 2 months in the beginning, but afterwards, somehow we have managed to stay ahead of the curve. One might say it's the hospitalization rate has been low and we were lucky. I don't want to get into that debate, but somehow we have managed the situation, and in relative to others. And in terms of the vaccine story, I think the challenge will be less complex than what we saw during the initial stages of the pandemic. I think the mentality of the policymakers are all focused on health. I think a lot of issues and these discourses are happening at a very regular level. They are engaging with global actors at a I think that level of information, so there is no knowledge gap in terms of how should we best handle it. So the protocols are, what are being developed are very well accepted international protocols. And I am hopeful, I'm cautiously hopeful. I mean, as I said, and as Dr. Shejuti Shaha was mentioning, we're handling with a new virus and a new solution, but the issues are old in terms of how you immunize people, and Bangladesh has a good track record of in terms of expanding immunization. If we get hold of a good vaccine, and for that we have kept our doors open for almost all the country, and I accept what Dr. Delwar said, that this is not a zero-sum game. If we get from India, doesn't mean that China is no longer our friend, and if we get from China and Russia, it doesn't mean that America is no longer a friend. We are not in any kind of zero-sum political framework. Every country understands that no single country will be able to fulfill our demand, and everybody understands that Bangladesh will open its door both multilaterally and bilaterally. So I am cautiously optimistic that we will get onto that vaccine ladder quickly as soon as it's here. However, I think we have to be very cautious in terms of climbing up that ladder. And I think the 3 phases that the government has designed to bring into coverage the roughly 140 million people or 100 million people, 100 million people that it has, I think that's a cautious way forward to see, to check the efficacy of the vaccination and, make that steady walk forward. A final point about, I think what also needs to happen is, I think we also need to revamp our testing much higher than what it is now. I think to ensure that that data is there for a very good vaccination solution, I think that is an area that needs a lot of attention. And I think we have not expanded the testing as we need, but I think that is an area that we should focus on to ensure that the vaccination protocols are effectively implemented. Thank you.
Thank you, Dr. Ashikur Rahman. So we have a question for Dr. Shejuti. Dr. Shejuti Shah, the question to you is from Salehin Zawad. He raises the issue of antimicrobial resistance. And he says that as drug-resistant pathogens continue to emerge and spread at an alarming rate, the next global health and development threat seems not very far away. What can be done by the scientific community to prevent any kind of future AMR outbreaks from turning into the next pandemic?
Thank you. And thanks for the question. I will answer that question, but I wanted to draw on a little bit from what Dr. Ashik ended with, how data is important to even understand vaccine efficacy in Bangladesh. I think we always have to remember, even when I was talking, I was kind of talking about how we need data to introduce the vaccine, to understand what vaccines will help our population the most. And I think I must also add to that, that after a vaccine comes into our country, it's also very, very important, equally important to understand vaccine impact, for which data is also important, right? So now we are kind of gathering this baseline data. What is COVID-19 like in Bangladesh? And once a vaccine comes, in order to keep our policymakers encouraged to continue helping us or distributing the vaccine, we also need to show that after the vaccine comes, disease has actually gone down, and have really good systems in place for that. And of course, expansion of testing is really important for that. Switching topics to antimicrobial resistance. Antimicrobial resistance in bacteria is a huge concern. We are seeing more and more antibiotic resistant organisms, not only in our country, but globally. And we also know that there aren't many new antibiotics in the pipeline. We are not seeing new antibiotics in the horizon because there aren't a lot of incentives into developing new antibiotics, specifically for diseases that affect low middle income countries. It is absolutely right. It is a global concern that very soon we will be hit with bacterial infections that are resistant to all available antibiotics, and we will go back to the pre-antibiotic era, right? In the early 1900s, where people died of simple infections, people died of simple cuts because we could not help with antibiotics. Of course, we now also have other preventative measures to decrease the burden of infections, but resistance to all therapeutics will be a problem. What can we do about it? I mean, the only thing we can do about is restrict use of antibiotics. When we use too much of unnecessary antibiotics to treat infections, it will lead to resistance, because bacteria are constantly fighting to gain resistance against every antibiotic used so that they can survive. We have to stop unnecessary use of antibiotics. We also have to develop a culture in Bangladesh where, when antibiotics are needed, we don't use the highest level of antibiotic, because usually when you use third, fourth generation of antibiotic and bacteria become resistant to those, they automatically are also resistant to first, second generations of antibiotics. Many of these bacterial infections can be treated with older first generation, second generation antibiotics. I think for us, it's really important to raise that awareness within our medical community, within even our general population, because we can buy antibiotics anywhere. Anybody can walk into a pharmacy and buy antibiotics. I think we need to raise awareness that you can start with a first generation, second generation antibiotic. If that doesn't work, then move on to higher levels of antibiotics. So antibiotic stewardship is going to be, I think, really important and key to fighting antimicrobial resistance. Thank you.
Thank you. I will ask another question, Dr. Shejati. That's the issue of data is coming up, from you and Dr. Ashik, everyone is saying. And we always talk about evidence-informed decision planning. But one question raised by Rubaya Moshed, very valid point, that do we have any study or any information about the willingness or choice in case of vaccine recipient in Bangladesh, that willingness to be vaccinated and subsequent initiative to induce people to get vaccinated? And if not, what's your suggestion that what type of research do we need to generate some other social and other economic data to help planning and managing the vaccination in Bangladesh?
Very good question. I actually don't know of any study personally that has looked at or done polls of how many people are willing to get vaccinated by the specific COVID vaccine or whatever vaccines come into the country. In general, I do think, Bangladesh is a very pro-vaccine country so far. So in general, idea that I get is most people are willing to take the vaccine, but this might change. And, as it was rightly pointed out, it's important to also have economic data to support vaccines. So oftentimes when we introduce vaccines, at least, till the MDG era, what we were doing is we introduced vaccines that decreased mortality. Our burden of disease was always looked at by how many people died. As we're moving into the SDG era, we also understand well-being is really important. Burden on the health system is really important. Costs are really important, whether it's to a family or to the health system of Bangladesh. So I think these are really important studies that we should do. Now, such studies, I don't know how much of them are being done in Bangladesh for COVID vaccine at the moment. However, we do have good studies that have been conducted to understand, the economic burden of, let's say, meningitis, the social burden of meningitis, economic burden of pneumonia. We are conducting a study for other vaccines, rotavirus vaccine, and then another vaccine upcoming for pneumonia caused by a virus called RSV, where we are actually looking at, even if a disease doesn't kill, but it is preventable and has high burden, we should introduce that vaccine, because our health system is struggling. We don't have enough capacity. Our number of beds, we have very few number of beds per 100,000 population, and we need to reserve those beds for who need it the most. So, the indirect impact of vaccines. So what we are showing in our studies is that if you take away a child with diarrhea, now children in Bangladesh don't die from diarrhea anymore. Usually they come to the hospital, stay a couple of nights, and then go home. But what they're doing is they're taking up beds in the hospital. And when they're taking up beds in the hospital, a child with, low birth weight, a child with meningitis who need immediate care might not be able to get that bed because it's taken up by a preventable disease. So I think those are the indirect impact of diseases, and COVID-19 is no different. We are seeing how, beds in hospitals are getting filled up. So I think it's really important to do these economic studies and understand the impact. Yeah, good question. Thank you.
Thank you, Dr. Shejiti. So I will just go back to Namira Shamim from Economic Studies Center. Namira, do you have any question or any other issue that you want to ask to the panelists, or shall we go to the questions that already have been posted on Facebook and just carry on with the questions to the?
We can carry on with the questions that came in from Facebook. That makes it engaging.
Thank you, Namira, for guiding us on these. So there are a number of interesting questions. I will not be very specific to anyone now, but I will follow the same format that I will go to Dr. Delwar and then Dr. Ashik and Dr. Shejiti to you, please. So stay with us. So I will ask a few questions. So just speak and give us some insights of this. So a number of questions are related to equity. So how we can ensure equity? I know you all have touched upon a bit, but it comes that there are some urban areas or some pockets in the urban area. Can we cover those? There are rural areas where do we really have the system in place to ensure the coverage of the vaccine in rural remote areas? So are we compromising equity? This is one question coming up a few times. Another question comes also the efficient management of vaccine inside the country. So how prepared we are? Again, the system issues, that the storage and management. So do we have enough infrastructure in place? And what are the challenges in managing vaccine and ensuring access for the entire population? So these are coming up from our participants multiple times. And also another question is again the nationalistic or ideological feeling. So again, some sort of geopolitical issues, that if you have any other reflection or that you did not say in the first round, if anyone wants to say about this. I will pick some other questions if it comes, but again, over to you about the equity, efficiency, quality, and also some side effects that some people also said to Dr. Shejiti, and if anyone can answer to this, that do we know the side effects of the current vaccines and safety, security issues? So again, starting with Dr. Delwar, over to you, if you give some reflection on the issues that I just raised. Would you please unmute yourself? We just can't hear.
Yeah, yeah. Sorry. Yeah. Thank you again. I think these are very interesting observations, and we have covered to some extent. And of course, we can talk. I mean, more and maybe this session is not enough. But well, equity is really a complex issue, we know, and equity can be considered. At a domestic level and also at global level, so it depends at what level we are thinking about equity. And when we talk about the issue of urban and rural divide, and also the divide based on income, and we know we are living in a world, we call it very globalized, but at the same time it is a world which is most unequal in its history, and it is a world which suffers injustice in every form. So already it is a world, whether we live in Bangladesh or in the USA, and look at the campaign issues in the US elections. I mean, that was held on 3rd November. You see, the issues are healthcare, issues are this poverty, issues are education. So it's really a world. On the one hand, we have high technology, we have huge development, and on the other hand, we know, I mean, we are facing very basic sort of curses of human society in terms of inequality, in terms of discrimination and injustice. So and vaccine, unfortunately, we have seen that it has come into a such kind of a world, and the world, we know, I mean, over the last few years, we have seen the world is turning towards more populist, more I mean, ultra rightist and all these things. So we cannot actually avoid all those things. I mean, when somebody has asked about these ideological issues or issues related to geopolitics. But for equity, I think this is very important issue. Of course, in general, for the world, or for the world leaders. But at the end of the day, equity issue comes at the micro level. I mean, I mean, if we consider at the individual country level, then the state and its leadership is very important, and how they actually see things. I mean, in terms of distribution, in terms of I mean, it's a kind of delivery. So here, I mean, in Bangladesh, of course, we have some issues of distribution and issues of equity. But I think we are in good place in the sense we have very good public policy and leadership and all these. They can actually consider. I mean, in the right context of Bangladesh, I mean, how we can face this issue of equity. But about vaccine, I think I am very concerned about because it is something which is not within the reach of Bangladesh, because it is with the reach of multinational corporation. It is within the reach of Pfizer. It is within the reach of Moderna. So we can see the game of profit making. We can see how the developed countries are actually thinking about it. What is their view? So the issue of equity at macro level or at the global level is really very important, and that we need to press again and again, I mean, as part of the civil society. So we have to think equity both at horizontal level, vertical level, at the state level, and also at the global level. And of course, everybody has also some role in terms of equity. It is not only just making vaccine available, it is also how we behave with people. I mean, because vaccine is not everything, because we are not getting it at once. So how we are actually behaving individually, how we are cooperating with the machineries who are actually are in charge of distribution or delivery. And well, I think, I mean, this ideological issue or the geopolitical issue is so much I mean, embedded in today's world, almost with all issues. I mean, whether these are issues of I mean, public good or private good, or collective good or network good, whatever we call these. But we can see to use the every issue in the world for politics, for profit, or for some kind of this global diplomacy. So there is a trend of, and we cannot actually discount it, because look at the leadership in the United States. I mean, what the President-elect Joe Biden is saying. I mean, he's talking about coming back to WHO. They want to return to the WHO. They want to join Paris climate deal, and they want to reverse a lot of decisions they took based on so-called America First policy. So this is the real issue. I mean, we cannot actually just simply say that we don't bother about what America is doing, or Germany is doing, or China is doing. Of course, there is a lot of politics there, a lot of this so-called geopolitical calculation is there. The very narrow kind of national interest is there. So we need to analyze them. We need to understand them, and as we need, particularly for this issue, of course, it has a lot of technical aspect, lot of this humanitarian aspect, but still we can see the linkage between the politics and these particular public health crisis in the world. So I think this is what I think at this point. But one point that I want to add, when we talk about equity, well, equity is important, but I'm also concerned about one point, that when we talk about vaccine, COVID vaccine, I guess there might be even some resistance against vaccine in different countries, even in Bangladesh. And if you talk to the people in the rural area in Bangladesh, they don't use mask. They don't want to use mask. They don't want to follow the health rules. They want to identify this is a disease of the rich people. This is a disease of the something coming from the heaven for the people who are not good people. But we cannot actually simply overlook this, because we have this kind of sentiment, not only Bangladesh, I mean, even in the United States, even in Europe. So we have developed a lot. We have become modernized in terms of symbols, but in terms of ideas, modernization has a lot to go, even in the world. I mean, in terms of ideas or our intellectual capability. So I guess there will be also resistance. We are talking about access to vaccine, but at the same time there will be resistance to vaccine, and how we can make people aware of the benefits of vaccine, and this will be also a challenge. I mean, we have to also deal with this for some time. So we have to plan a lot of things for this. Thank you.
Thank you, Dr. Delwar. So Dr. Ashik, if you want to reflect on what Dr. Delwar was saying, that in terms of equity, but we have another question, just if you want to reflect on that we know pharmaceutical companies are also working in this ground, and they are also investing quite a lot for research and also bringing those in Bangladesh. So what is, if there is any way to bring them under direct accountability and scrutiny? So this is a question from Numair Ahmed.
I did
overall reflection.
So I did not get your second question. Are you talking about international companies or local companies?
Of course, these are related. There are global pharmaceutical industries, and also we have some local industries as well. So the pharmaceutical industries, they have their role in vaccine diplomacy. So any reflection on that, and if there is any way of bringing them under some accountability or scrutiny? This is one of the questions. But overall, your reflection of what Dr. Delwar said, or other question that our participants just raised. So briefly, your reflection on this.
No, thank you. I think, in terms of equity, I think Dr. Shejyoti Shaha earlier touched that the issue of equity has always been there for vaccinations, right? I mean, not everybody had it in its history. Those who could afford it had it. But I think this crisis, if you see the health protocols that are being placed, the government has already made it very clear that it's going to avail, it's going to give access to the vaccine to people who need it the most. So frontline workers, people with preconditions, people who are above certain age threshold will have the first right, so-called over the vaccine, right? And I think that's the most cautious way to go for it. To say that equity in this particular context should be measured by the income threshold, I don't think that's that's complete. I think you need to actually see who are the most vulnerable groups, and you need to ensure that they are the first ones who get onto the vaccine ladder. And I think that is already in the brainstorming stage, and government has, I mean, not only Bangladeshi government, I think throughout the world, I think now it's an accepted fact that some cohort of the population are more vulnerable to this disease, have a high mortality rate, and they will have the first access. The frontline workers, those who are above, those who have conditions like diabetes and kidney, and those respiratory problems. I think that's a fair kind of framework to ensure who has access to this disease. And it's also the vaccine, the price of the vaccine, it is itself not very high. $2 to $5, given the severity of the problem, this is much below one would have previously assumed, right? If you asked me like 6 months ago, I would have been thinking around $15 to $20 threshold, but it seems like the price is also very within very reasonable limits. 2 doses for $5 to $2, I think that's a very that's within certain an income group that almost even people working at the informal sector, that's a one-day wage for somebody who's working at the informal sector. And I think so we should not get too worried about access from the income threshold. Of course, knowledge and information, and what Dr. Delwar was saying, whether the hesitancy towards information, whether they take the disease seriously, whether they classify it as a rich man's disease, those are other issues that those needs debunking. And for that, you need also more knowledge, more kind of data to actually see that which kind of social groups have been mostly affected. And I think that knowledge gap needs to be addressed for us to tailor policies. In terms of the global issue, yes, I know I want to go back to that quotation from Bertrand Russell. I think he famously said that what can redeem mankind is cooperation for common cause. And I think with the elections in US, I think some sanity will be injected in US political decision making. US is a very important decision maker at the global stage for public health, for issues like climate change. And I think this pandemic, for me as a social scientist, has been a precursor to what is needed for climate change. This pandemic has shown us the kind of fault lines we have, the kind of fractures we have in global institutions, in collective decision making, and to take cooperation at the global level, to act immediately, to work together, kind of the cooperation that was seen by the scientists and the pharmaceutical industries. For me, it has been like it has been the drill that I don't know this. I don't know. I should not probably say it, but it's kind of the silver lining of this virus. And I don't want to say silver lining because millions have died, but I don't want to pay any disrespect. But the kind of the silver lining to this virus is that it has waken us up. That look, at the end of the day, you are just a species, and you have a common threats. Be it climate change, be it a pandemic, you face common change, common threats when you live in this planet, right? And whether you are defined by your religious, national, cultural identity, the virus will not judge you by your national identity, by your economic identity, by your cultural identity, or your religious identity. The virus will see you just as a species, whether it can impact you, whether it can live within you, and or the side effect of killing you, right? So you are not judged by those parameters. And I think this is the kind of thinking that we needed at the global level for us to wake up to larger threats that are there that we have to face collectively. And I feel that has been the story of humanity, right? We have navigated a lot of problems throughout at least last 2 centuries. And I think with sensible leadership at the top, with sensible leadership in global institutions, and I'm always hopeful. I am always hopeful that we will do the right thing, and we will do it in a timely manner. And that's the best we can do. As a part of the global civil society, we have to flag these issues, and we have to press politicians, policymakers, so they raise these issues at the global platform. And I think these kind of discussions help. And but solutions are never easy, and we just have to hope for the best.
Thank you, Dr. Ashik. We are hopeful too, and definitely we hope that we will overcome these with the great leadership at the top level in our country and with their commitment. So the last speaker, Dr. Shejati Shahak, the last comments, any reflection from your end?
Sure, thanks again. So let's go back to how we started. We started with equity, and let's remind ourselves what equity is and what is the difference between equity and equality, right? So for our speakers, it's a term we know, we understand the difference, but perhaps for some of our viewers, what is the difference between equality and equity? Equality is you give everybody the same amount, right? You give everybody 2 balls or 2 toys. You hang an apple, which is 5 feet from the ground, and you expect everyone to have equal access to that apple. But equity is making sure everybody has a level playing field. When you're hanging an apple that is 5 feet from the ground, is accessible to someone who is 6 feet, who is 5 feet, but might not be accessible to a child who is 2 feet or a newborn. So with equity, what we try to do is basically you're hanging apples at different heights, making sure that everybody has equitable access to that apple. So that's what we are talking about here, right? That's why we talk about who is going to have access to vaccines. Healthcare workers need access to vaccines because they are most exposed. They're most at risk. They're risking their lives to save other people's lives. And really, even if we think the rate is definitely lower than many other North Europe, we cannot deny that our health workers are also learning, and they're giving us more and more better and better care, which is also helping us reduce mortality, giving us the care we need. So they need to be protected. They are risking. So that is why equity is important. Equity is important because, people over the age of 60 are at most risk. People who already have comorbid conditions are at most risk. So we need people, watching this video can go buy vaccine, but most of the population in Bangladesh might not be able to afford that. So we need to make sure they have access to the vaccine too. As for, I've already talked about our EPI program, the expanded immunization program of Bangladesh a bit at the beginning. And we said that we are, Dr. Oktanu also pointed out in the chat that Bangladesh so far has the least vaccine hesitancy advantage. And at the same time, I guess another advantage at the moment is the density. Our country is very small and most of our country is flat. We are able to access population. So we don't have to carry a vaccine in a truck for days or for hours to reach the population who need it. Because we have dense population, we can actually we'll have access. People who give vaccines will have access to the population faster. We can set up booths where many people can come and get the vaccines. And I think that's an advantage we have. Rural and urban is definitely a very, very important point. And Dr. Delwar actually rightly pointed out that things might change because this is not a normal vaccine. We have no experience of vaccinating the entire country or the adult population of our country. Now, the advantage is our rural communities are actually even more pro-vaccine than our urban communities. When we look at vaccine coverage, Dhaka actually has one of the lowest vaccine coverage compared to everywhere else in Bangladesh. So the mothers, we say if you go into a household in a rural region, in a village, and you ask the mother, hey, how do you know that you have to vaccinate your child? She'll have this question on her face as if everybody knows you need to vaccinate your child. There's nothing to ask about it. That's just within our culture. However, of course, this might change, as Dr. Delwar pointed out, because there are these ideas or thoughts or rumors that are going around in the country. And I think that's really important to keep in mind. And perhaps these discussions will help us design some studies before we even get to that stage when it's too late to do anything. Why don't we do some polls? Why don't we already start talking to those populations and see how we can break those barriers? Mass campaigns will be important. Certain things that have worked before might not work. Every year we do mass campaigns for vaccination. However, mass campaigns are also difficult to do during COVID, when we are the ones also saying don't go to social gatherings, right? So those things will become a little difficult, but I think this is the time to also figure out, how do we campaign? What role does media have, social media or other kinds of media, to actually help us ensure everybody is aware, we spread knowledge, and we educate to ensure equitable access and delivery. When this pandemic started, my parents and I would often talk about, hey, this is good. This is the first time there is a disease that affects everybody, despite nationality, despite religion, sex, because usually, at least in my field, I'm constantly dealing with diseases that affect a certain population. Even within Bangladesh, most privileged don't have infectious diseases. So we were like, maybe this is what is going to unite the world. But sometimes I feel maybe that wasn't right. That is like, this disease has not led to unity. In certain cases, we are seeing more divides. But I do hope that that changes, and we have to constantly remember that no one is safe till everyone is safe. At least, our groups, people who come to these panels and webinars, should work together. Multidisciplinary people should work together to take this thought forward, that we need to make sure everybody is safe. And I hope these lessons that we are learning from COVID-19, and I always call it a magnifying glass of the problems that already existed, issues that already existed. I hope we take the lessons forward, because we have many other diseases that we have to fight by ourselves. Thank you.
Thank you. And we discussed about the geopolitical rivalry, the aid diplomacy, and we be careful and cautious, as all of you said, that it's really early stage and we have to move very cautiously. And while we move, equality, and also we need to focus on our governance, that how we really manage this efficiently. And definitely we have to have data to support our policy, and we need infrastructure for the vaccine management and training and capacity development of people at different level. And we are really hopeful, because we have high level commitment to overcome this situation and to make vaccine available to the population who are in greater need. So thank you everyone for joining this very important dialogue, and thanks to Economic Studies Center for inviting me to chair the session. I tried my best to manage time, but I think it's the panelists who really maintained, the time and managed time quite efficiently. So over to you, Namira, and thanks everyone for being with us. Thank you.
Thank you. Thank you for inviting us.
Thank you so much.
We have come to the end of ESC Dialogue Episode 5. Thank you so much to our amazing panelists, Dr. Shrijiti Shaha, Dr. Ashikur Rahman, and Dr. Delwar Hossain, for such an insightful discussion, and our respected session chair, Dr. Rumana Huque, for conducting the session so smoothly. And thank you to our viewers for engaging with our dialogue and putting forward so many questions and comments. Thank you.
Thank you. Thank you very much.
Thank you.